coming up next. So here we go, PhyzzIO. There we go. All right, guys, come on up. Really excited to present actually the second annual elevator competition winners for this year, a PhyzzIO. And they're going to share with you what they've created and a journey you actually started here in this building in January when they won Startup Weekend. So, PhyzzIO.
Hi, we're PhyzzIO, empowering motion, enabling progress. So Ani, who are we?
We're PhyzzIO, an AI physiotherapy platform that allows physiotherapists to provide more accessible treatment for physiotherapy patients and also help them adhere to the treatment.
So now, picture this. You drive to a physiotherapy center 30 minutes away, wait uncomfortably in the lobby for another 30 minutes, just to spend the next 2 hours doing simple stretches.
It's exactly what Joe, our co-founder, and millions of other physiotherapy patients have to go through every day until they recover from their treatment, most of them dropping out halfway due to several reasons.
And after talking to my fellow patients, I realized that this is not an issue that I personally face, but something that's very prevalent in the entire physiotherapy community.
Yeah, from the research we've done, we found out that 70% of the physiotherapy patients do not adhere to the treatment, and most of them drop out by week 4 or 5.
Almost 27.9% of the patients cannot access physiotherapy, often due to wait time, location, and cost, which happen to be the same issues that I personally faced. And this, in turn, throws physiotherapy centers into a vicious cycle.
Yeah. The lack of communication between the center and the patient results in lowering of satisfaction scores for the patient, and this also impacts the Medicare reimbursements the physiotherapy centers receive. And this also limits the number of patients who continue treatment with such physiotherapy centers, putting them into poor financial performance.
And the low financial performance, in turn, increases physician burnout, leading to low treatment quality, and thus repeating the cycle. However, we have a way to break free from this, and that's PhyzzIO.
Yeah. PhyzzIO is an interactive application and a B2B SaaS platform that allows physiotherapy patients to adhere to their treatment and also perform their exercises with great precision and accuracy using a form guide.
PhyzzIO also has a 24/7 assistant that tracks, guides, and monitors the patient's journey throughout their treatment.
PhyzzIO also provides a feedback loop and a communication channel between the patient and the center so that the physiotherapist can monitor the patient's progress seamlessly. Through PhyzzIO, we offer several benefits. We enable the physiotherapy center to be more accessible for patients located in remote areas so that they can continue their treatment without any hurdles.
PhyzzIO also aims to increase patient satisfaction and experience, allowing for higher reimbursements and retention of Medicare reimbursements, assisting physiotherapy centers with their financial performance.
We also aim to increase the treatment adherence for the patients by tracking their progress and also motivating them to go ahead with the treatment until recovery.
After talking to various individuals, we realized that 5 out of 5 physiotherapists actually do see a severe lack of adherence in their patients and showed interest in PhyzzIO.
Out of the 20 patients we talked to, all of the patients prefer going to physiotherapy centers and physiotherapists who use softwares like PhyzzIO for their treatment to enhance treatment quality and experience.
Our total addressable market happens to be the US physiotherapy centers, which accounts for around $43.2 billion. Our service attainable market is the percentage of physiotherapy centers in Ohio, which brings on our market to $1.77 billion.
We're mainly targeting the suburban and rural physiotherapy centers to provide more accessible treatment for patients, and this is a market of $384 million. We're mainly a B2B SaaS platform providing software services for physiotherapy centers.
And we aim to achieve this through a multi-tier subscription model where our diverse plans cater to the needs of each physiotherapy center.
We plan to provide frequent updates, data analysis for the centers, and also continuous tech support throughout our service in the center. In this field, we do have competition, but PhyzzIO definitely stands out. We aim to have the highest financial impact for the physiotherapy center by helping them increase treatment quality and experience, thereby increasing the Medicare reimbursements and also the number of patients who continue the treatment with the center.
PhyzzIO is also a highly personal application. As our AI grows with the patient, it adapts to the various needs and requirements of the patient throughout the treatment.
We're Team PhyzzIO. I'm Aniruddhan Ramesh, a computer science student and a bioinformatics software developer and student researcher with expertise in AI.
I'm Kuncheria, a mechanical engineering student with expertise in biomechanics. And together, we believe we're the perfect duo to bring this app to fruition. Our current project timeline is that in 3 months, we hope to have a working prototype, and in 6 months, we hope to be conducting demos and gathering further traction.
9 months from now, we plan to work with physiotherapy centers in further refining our product and conduct user testing. And 12 months from now, we plan to deploy our pilot programs in partnerships with physiotherapy centers. We kindly ask for your connections and expertise in the following. We would like your expertise and connections to help us find an advisor for our team who can help us navigate through the physiotherapy and healthcare field, and also provide us essential connections through which we can contact physiotherapy centers and work with them so that we can develop our product.
Additionally, we require assistance with legal advice when it comes to healthcare and patent laws as we navigate the various restrictions in the telehealth industry. Thank you so much, and please contact us as we embark on this new journey. Thank you.
Thank you.
Wow. Nice job. All right. Anybody have questions for Physio? Jeffrey.
So this is an interesting thing for a couple of college students to be working on.
Yeah.
So I'm interested in your founder story.
Yeah. So Joe, he's the co-founder, and he's also my really good friend. So in fall, he actually tore his ACL playing soccer, and he had a lot of struggle in actually getting treatment.
And yeah, based off these struggles, I was talking to Ani about it, and we decided let's dig deeper into it, see if it's something that was something that's isolated to me, or rather something that everyone faced. And surprise or not, that happened to be. And luckily, we were here at the innovation weekend last semester, and
I didn't see it on your chart. So local startup doing really well called Band Connect. Are you aware of it? Do you need connections to it? I mean, I know Kate and Josie can make that connection, but they're in a very, very similar space. I guess the first question, are you aware of Band Connect? If the answer is no, then we'll catch up after.
Yeah. Could you repeat the name?
Band, B-A-N-D,
okay.
Connect.
From the research we've done, we have actually not come across that company. Yeah, but
they're a venture. Yeah, they're one of our venture lab teams that have been recently funded. They just went through Techstar, so
we will get you guys with Abby.
Yeah, thank you so much for that.
Any other questions? Yes.
So I'm interested in what you consider your product. Is it the delivery of the physiotherapy, or is it the platform that's delivering it?
So we're mainly an application and a software and we're providing this software to physiotherapy centers. So this software has a lot of features. One is a form guide that will monitor physiotherapy patients performing simple exercises, and also a chatbot that will answer all sorts of questions and regarding the exercises that's prescribed by the physiotherapy center for the patient, so that the patient does not have any questions while performing the exercises in the house. And also a communication channel and a direct connection to the physiotherapy center so that the physiotherapist can monitor whatever exercises they're doing and how far they've gone through in the treatment progress.
Additionally, our goal is to complement a physiotherapy center rather than to replace one, as there are certain aspects that need to be done on the spot, but our app would help them assist their progress and make sure they achieve optimum results.
All right, thanks guys, appreciate it. Thank you, great job. Thank you.